Good noon to everybody. Welcome back again online video lecture class of biochemistry. Here I am presenter Dr. Subir Kumar Mandal, Assistant Professor, Biochemistry Department at the Akij Medical College and a hospital, Khulna, Bangladesh. Previously, I discussed about sampling procedures, sample collection. So today I will discuss the final part of this topic, which is started from the anticoagulants. This is most frequent questions during Viva board or in written exam. So at first, what is anticoagulant or what are the varieties of anticoagulants? When blood is collected, it clots after some time. We know this is the normal phenomena. So the anticoagulants are the chemical agents which prevent the clotting of blood when mixed with blood sample in proper proportion. So anticoagulants usually block the normal clotting process. So what are the purposes of using these types of anticoagulants? For studying various constituents of blood components, study of coagulation, mainly clotting of blood, preservation of blood in blood bank. Now, what are the properties of anticoagulants? Anticoagulant must be soluble in blood, it keep blood in fluid condition, do not cause hemolysis of blood cells, do not change the size of RBC. Anticoagulants minimize destruction of leukocytes, and finally it minimizes aggregation of platelets. These are the important properties of good anticoagulants. Now, what are the classifications of anticoagulants? There is two important basic category, mainly which are used in vivo and which are used in vitro. So at first, I will discuss anticoagulants that are acts in vivo or inside of the body. So in parenteral anticoagulants category, we usually use low molecular weight heparin, or in simple language heparin. And in oral anticoagulant category, we always use warfarin. Means two anticoagulants that are usually used in vivo cases, one is heparin and another one is warfarin. Now, anticoagulants that are used usually in vitro purposes. Number one, calcium chelator that will bind with calcium, such as ammonium oxalate, potassium oxalate, and EDTA or ethylene diamine tetraacid, and finally sodium citrate. Number two, non-calcium chelator. It doesn't bind with calcium, that's why it's called non-calcium or non-calcium binding chelator. Usually heparin, sodium fluoride belongs in this group. There are several types of commercial forms of low molecular weight heparin or warfarin in market. So I will tell about the mechanism of action of these types of or several anticoagulants. At first, heparin. Heparin is the cofactor of antithrombin 3. It combines with antithrombin 3 and blocks the effect of thrombin during conversion of fibrinogen into insoluble fibrin thread. This is the basic mechanism of action of heparin. Number two, EDTA or ethylene diamine tetraacetic acid. It's used for determination of total count of RBC, WBC, differential count of WBC, ESR estimation, etc. This is the principal uses. It's a calcium chelating agent and remove free calcium from blood to prevent clotting, because we know there are important or basic clotting factor. Calcium is one of them. Now, sodium citrate. Sodium citrate used in blood transfusion usually. It is the common importance or common using form in blood transfusion bag, in blood bank, PT calculation or prothrombin time calculation, partial thromboplastin time estimation, It acts as a calcium chelating agent, means it removes the free calcium ion from the circulating blood. Next, Paul Heller's mixture. It is more common, or it is the more common name in physiology lab. It is the combination of ammonium and potassium oxalate. It's used for determination of fat cell volume, mean corpuscular volume, mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration. It acts as a calcium chelating agent. Next, sodium chloride. Used for glucose estimation. I discussed during metabolism card during glycolysis. It is commonly used during blood glucose estimation, sodium chloride, because it prevents glycolysis by blocking enolase enzyme. Now, what are the changes of unprocessed blood? Number 1, blood glucose level will decreases. Number 2, increased lactic acid level. Number 3, blood pH decreases due to lactate production. Number 4, carbon dioxide will diffuse out from blood, plasma carbon dioxide decreases. Next, hemolysis will be increased, plasma level of potassium, LDH, TLT will be higher. Bilirubin destruction increase due to daylight, because we already know daylight usually destroy bilirubin. And formation of ammonia from urea. These are the all important changes if we fill down unprocessed blood in empty chamber. Now, I will discuss about the urine collection or urine sampling process or urine sample collection procedure. So, there are several types of sample collection in case of urine. First, its most commonly used sample, which is called early morning sample. Next, random sample. It is the routine test. Next, 24-hour sample. Next, midstream sample, which is usually performed for diagnosis of urinary tract infection. Next, postprandial sample, which is usually done for identify or diagnosing diabetes mellitus. In case of catheterized patient, in infants or bedridden patients, we perform the urine collection through this process. And the last one and the most important, which is known as suprapubic needle aspiration. There are several collecting forms or collecting pots for urine in laboratory. In case of urine collection, improper urine collection may invalidate the results. So, containers for collection of urine should be wide-mouthed, clean and dry. Earlier first morning sample used to measure chemical constituents, cast and crystals. Random specimen used for chemical screening and microscopic examinations. 24 hours urine sample, quantitative estimation of proteins, sugars, electrolytes and hormones. The first morning sample is not collected. So, what are the ways of preservation of urine sample? Our first choice is refrigeration. By the process of refrigeration, you can collect and preserve sample very nicely. Second option is hydrochloric acid for 24 hours urinary sample preservation. Next, toluene as a physical barrier, it also used in biochemistry lab or pathology lab. Then boric acid, a general preservative, it is widely used preservative in case of urine sampling procedure or urine sample collection. Others include thymol, formaldehyde, acetic acid, etc. By this process, we can easily preserve urine in good way. So, for routine analysis of urine, preservatives should be avoided as they interfere with reagent strip technique and chemical test for proteins. After centrifugation, the urine sample is labeled correctly. In case of delay, sample must be kept in refrigerator that I discussed very early for maximum 8 hours. Test should be done after returning to the room temperature, and in recent time or recent years, refrigeration is even more successful when combined with urinary preservatives or acidification if we maintain pH less than 3. This is the latest technique by preservation of urine sample. Urine should not be kept for more than 30 minutes in room temperature without preservative is the important point. Urine sample should be examined within 1 to 2 hours of voiding. That's all for today. This was the final part of clinical biochemistry first item. I hope you all have enjoyed this session. So, see you again with a new topic. Thank you today. Thank you for patient sharing. Many thanks.